It's crucially important that Nigeria fund and increase the funding for epidemic preparedness. This will save lives and it will save money. Funding of epidemic preparedness prevents diseases that could spread, not only killing people, but also costing lots of money in healthcare and societal costs for a wide variety of causes, ranging from tourism to business.
I support epidemic preparedness funding because that is the right thing to do for our society. That makes us responsible representatives of our people.
I support the funding for the prevention of infectious diseases because I know that a healthy nation will become a productive nation.
It is our duty at all times while we are in the National Assembly here to make sure that their interest is uppermost in everything we do, especially as far as their health is concerned, because health is wealth.
Is Nigeria prepared for the next pandemic? This is a question one key policymaker responded to in 2019 with some chilling answers.
I would say we are fairly prepared. It's not sufficient and it's not adequate. I say fairly because in the past, we don't have agencies like NCDC. When we had the last Ebola outbreak and Nigeria was affected in Lagos, Nigeria was able to contain it and was able to respond effectively using the existing system. But Nigeria rather has learned lessons from that. And some element of operations are now there. It's part of those lessons learned that brought about the NCDC. It's a very new organization that came into being just within the 8th Assembly. So that organization requires additional funding to be able to make Nigeria better prepared for any emergencies, or any epidemic.
It is 2022, however, and it is safe to say the world is in a different place than it was in 2019. What has changed? For one, terms like pandemics, prevalence rate, and other terms that one might only expect to hear in, say, an epidemiology lecture have now become commonplace in public discourse. If the last 2 years have shown anything, it is that epidemic preparedness needs to be everyone's business. Much of the world learned this key lesson in the last 2 years, but one project has been working to increase public awareness and support for epidemic prevention and understanding, and support among policymakers for dedicated epidemic preparedness funding long before coronavirus made it to the headlines of global news outlets. The Prevent Epidemics project, through public awareness and advocacy for sustained funding, seeks to improve epidemic preparedness in Nigeria. The project continues to advocate for financial support for disease surveillance and preparedness. Its objectives are to build and increase public awareness and support for epidemic prevention and understanding, and support among policymakers for dedicated epidemic preparedness funding. The project leverages on social media and other media, radio, print, and television using the hashtag PreventEpidemicsNiger to grow engagements with the public and policymakers. Since October 2018, Nigeria Health Watch has been working with the Global Health Advocacy Incubator to raise public and policymaker awareness and demand for epidemic preparedness, and a robust budget for Nigeria Center for Disease Control in particular. In part, due to project efforts, the National Assembly added 100 million naira to the Nigeria Center for Disease Control's 2020 budget and increased the 2021 budget allocation by 75%. The scope of the project increased with the primary purpose of increasing state-level funding for epidemic preparedness and response in Kano and Lagos states. Implementation of the Prevent Epidemics project commenced in Kano State in July 2020, while project implementation commenced in Lagos State in April 2021.
We developed National Action Plan for Health Security, looking at the gaps that existed in the health security in the country following the JEA, and this integrated different plans across different MDAs, and it was a country-specific activities, and it was costed the 5 years plan. Following that, we looked at the resources available in the domestic funding. We advocated to all the partners as well to ensure that they key into the plan and make resources available to in the country, and of course we advocated to policymakers as well to prioritize National Action Plan for Health Security. So we've been able to leverage on the Nigeria Health Watch advocacy strengths and their communication strengths to conduct advocacy visits to all the technical lead directors, their director generals where need be, and different ministries as well, to ensure that we advocate for more funding for NAPs, and also to ensure that NAPs are prioritized in their annual budget.
The Preventive Epidemics project commenced, and the real aims of that was two things. So public awareness and also policymaker awareness about the need to ensure that epidemic preparedness is prioritized. And the big difference is, in most countries, there are public health institutes that are funded to support the country when there are health emergencies, and NCDC was severely underfunded. So the project's genesis was really to ensure that there was sustained funding, budgetary allocation to the public health institutes to ensure our public health security.
Through every advocacy vehicle possible, the project engaged at policymaker and implementer levels to ensure that budgetary allocation for Nigeria's Public Health Institute increased.
Epidemics affect everybody, and health security should be important to everybody in the world. Nigeria is a big country, it's huge, so the current funding portfolio or funding envelope of NCDC is not enough to be able to meet all that is required based on its mandate. The best and effective response is a system response, where your system is robust enough to be able to respond to emergencies. When you do have emergencies, when you have a robust system, it will be able to respond and contain, but you may need additional effort. So in terms of that robustness, yes, definitely there's need for more to be done in terms of funding, but not only fund, but in terms of using that fund to do what is necessary.
The work we're doing on Prevent Epidemics project, we're working in a consortium with two other organizations, LISDAL and Budget.
Collectively, this consortium has documented record impact in the lifetime of the project.
LISDAL was commissioned to do this project to respond to a number of challenges at the national and level and in supported states being Lagos and Kano State. One, because of suboptimal public investment in health security and limited government responsiveness in terms of having necessary legal and policy framework, and institutional framework as well needed to address health security issues.
Since the Prevent Epidemics project started, Nigeria Health Watch, a health communication advocacy organization, the main work we do is advocacy for the priority issues. So we have done this in a variety of ways. We have engaged policymakers and ensured that they have a heightened awareness of the needs for epidemic preparedness. So the work we did was also part of ensuring that all the work streams identified under the National Action Plan for Health Security was funded, because we know that it is a multi-sectoral approach that would require us to be well prepared. So we're looking at using a One Health approach, animal health, environmental, and also health. So there were several MDAs that were responsible for the different aspects of gaps that were identified in JEE. So the work we did was both working with the policymakers, but also working with the media to ensure that they have the adequate knowledge to report on epidemic preparedness and response.
What the project sort of afforded us was the opportunity to sort of sensitize the public on epidemic preparedness generally and health security. The second thing we were trying to also look at was the resource allocation to epidemic preparedness and health security, and that's through the budget. And also, we also tried to ensure accountability through the tracking of both budgets and projects, which these allocated sums in the budget, where we're trying to address.
I became a fellow of Prevent Epidemics, one of the first, group of fellows, and That has really been a learning curve for me. We've come to see that in spite of all the money people have, you can have all the wealth, you can have everything. But if you don't have health, will you truly enjoy that wealth? So promoting, healthy living, healthy lifestyles, and encouraging people to be conscious of their health is one of the benefits of this project for me.
I think like any other development project, what we did first was to understand the landscape in terms of a deeper understanding of what the problems are and a deeper understanding of the stakeholders and a deeper understanding of the existing institutional arrangements and the political capital that exists at both national level and supported states. So when we got to Kano State in 2020, there was actually no budget line for health security. There was no legal framework and there was no policy framework for health security. And then coupled with the fact that the general thinking of the policy maker then was that health security is in the purview of development partners, probably it's not the responsibility of the government. So we had to change that mindset.
We really engaged the Ministry of Health under the Public Health Department and Disease Control, and also the leadership. We got the absolute cooperation from the leadership of the ministry, the commissioner himself, and also we reached out to the planning and budgets because they are the custodian of the whole budget document in the states, and they really played a very vital role, as well as the State House of Assembly. We really worked through the relevant committees, the Finance Committee, Appropriation Committee, the Health Committee at the State House of Assembly.
Across the state and the national level, what we had to do again, because it's not enough to mobilize additional funding for anything. You have to look at how do we increase efficiency as well. So we work in the area of putting in place accountability framework.
Some of the achievements in Kano State are as follows. A budget line, Epidemic Preparedness and Response, was created with an allocation of 300 million naira in the 2021 budget. The budget for Epidemic Preparedness and Response was increased to 400 million naira in the 2022 budget. The state was supported to conduct a joint external evaluation and develop the draft Kano State Action Plan for Health Security in 2021. Each of the 44 local governments in the state allocated 3 million naira to epidemic preparedness and response in the approved 2022 budget.
When you talk about health security, it's a very important and topical issue, especially looking at the COVID-19 experience that we had about since 2019 to date. It has really exposed our weaknesses in terms of response to emergencies, and that galvanized the state to make some adjustments to ensure that we become responsive, we improve on our weaknesses.
Joint external evaluation was conducted in Kano State to assess our health security core capacity and our ability to reposition the health system in the concept of One Health as it relates to the international health regulation. As we speak today, with the support of this project and other key partners, we now have a proposed Kano State Public Health Security Bill that has been developed, multi-stakeholder, world robust, looking at the One Health concept. And of course, the ministry has vetted it with key technical personnel.
All these efforts combined have been able to help us to increase allocation, create budget lines, start the process of having a policy framework, and at the same time strengthen the accountability so that we have more money for health security, but at the same time we have more results for the money being allocated as well.
One notable achievement in Lagos State was a new budget line, Public Health Epidemics, created in the 2022 budget, a 950 million naira capital budget and 4.12 million naira overhead budget allocated to the budget line.
Our health budget caters for health security in general, and then there's a special segment of the health budget that is to prepare Lagos State for a biosecurity threat or a pandemic. Yes. So obviously we had a fairly robust pandemic budget before, but COVID showed us that we needed to inject a lot more money into the COVID response, and so we had to take funds from other parts of our budget to supplement.
All the Prevent Epidemics project implementers and collaborators celebrate these gains. The COVID-19 pandemic has revealed a global failure to take epidemic prevention, preparedness, and response seriously and prioritize it accordingly. It has exposed in real time the devastating effect epidemics can have on the economy, health systems, governance, culture, and religion. It also revealed important gaps in Nigeria's capacity to prepare for, detect, and respond to epidemics, and the need to raise awareness and advocate for the nation to devote considerable political capital and economic resources to building its epidemic preparedness and response capacity to improve its health security.
There have been low moments as well, when you're trying to get government to look at health, focus on health. Come on, what does it take? And having all the partners come together to say, focus on health, let health get its budgets, let health do this, let health do that. There have been those low moments.
One of the key challenges that we are facing is the issue of releases. Of course, as an advocate for health budgets for quite long, this is one of the key areas where we're having challenge, the releases and cash backing.
Local governments needs to also begin to allocate funds for EPR, emergencies, epidemic preparedness and response. They need to have budget line. And that is, I think, one of the next steps that is being planned presently to engage the local government. The ones that we've been doing before now is the state government.
I think there is a gap in people's awareness and understanding that we actually have to have sustained budgets allocated to ensuring that in the communities they live in and work in, that if there's an outbreak, that there is adequate human resources or lab capacity to respond to that. So that's the first challenge. We need to overcome that public apathy. Second of all, policymakers are critical in ensuring that funding is allocated. But what we identify also as a gap is at the state level, there isn't enough awareness that they too have a responsibility. So the work we've done has started that process of increasing their awareness, but also at the national level, at the states and the communities, there is also that awareness that we need to keep on raising with policymakers that a disease can start in a community. So we need to ensure that policymakers too are aware about the importance of epidemic preparedness.
So, what is next for the Prevent Epidemics project, its partners, collaborators, and stakeholders? The consensus is that collaboration, continued advocacy, as well as innovation needs to continue to move from challenges to change.
We are looking for more a sustained framework for engaging the private sector, so that private sector can contribute their financial resources, their technical resources, and including their social capital as well towards implementing the National Action Plan on Security.
I think we have started on a good note. I think what has supported and helped the work we've done is everybody has experienced COVID-19, so they know when we talk about funding for epidemics, they know what an epidemic looks like and what it feels like, more importantly. But going forwards, we need to continue sustaining this awareness. Epidemics do not give us timetables when they will occur. We are now going through another outbreak, although when we talk about the current outbreak, monkeypox, it's endemic in Nigeria. But the difference now is it's now spread globally. And that heightened awareness globally I think has given us more impetus that the work we do has got to continue. It's extremely important, and preparedness has got to be front and center of what policymakers prioritize, especially as we're currently in an election year.
The COVID-19 pandemic has shown that disease outbreaks occur more often and spread faster and farther than ever before. Additional investments in epidemic preparedness are needed to sustain life-saving health security gains and ensure Nigeria is able to prevent, find, and stop disease outbreaks before they get out of control and threaten our lives and economic development. Preventing epidemics is everyone's business. Get involved and take responsibility.